Permission, Chandrasekhar, we will be recording this session and this will be available for members, to refer to in case they have missed. So we are recording it. I have Bhavya with me, my colleague joining. So Bhavya will take care of the recordings. Yes. So again, very good afternoon to everyone and welcome to the OCI Public Health Special Interest Group monthly webinar. A little information about what special interest group is. This is a special interest group which is dedicated to public health and eye, and we encourage optometrists to join this group who are passionate about public health and community optometry. OCI has 5 such special interest groups, and depending upon your interest in the specific specialties, you can join the community on Facebook. It's a Facebook community, and there are no charges. You can please join them. If you want the links, we can put the links in the chat box. As the field of optometry continues to evolve, the role of optometry is expanding and it is going beyond traditional clinical care. Today's session aims to shed light on how optometrists can play a critical role in public health, from preventive eye care programs and community outreach to vision screening initiatives that shapes the future of eye health. We are honored to have with us Mr. Chandrasekhar M., who has been actively involved in integrating eye care into broader public health systems. He will be talking on Beyond the Clinic and opportunities for optometrists in public health. Chandrasekhar is a postgraduate in public health and holds an integrated master's degree in optometry and vision science from the University of Hyderabad. He is currently pursuing his PhD in community eye care at the BITS Pilani Hyderabad campus. His research interests are in program management, social determinants of health, visual impairment, and developing models for the prevention of blindness through promotion. He has expertise in eye care programs and research. He works for a leading not-for-profit eye care organization, Vision Spring, as deputy lead C to Earn programs for South India. Previously, he was associated with Sightsavers India as the zonal coordinator for South India. And with India Vision Institute as program manager. Having a decade of experience in public health and managing eye care programs and projects from concept to completion. So thank you, Chandrasekhar, for accepting our invitation. And we know this has been long due. We really wanted you. And as you know, OCI has always been very passionate about community optometry and establishing the role of optometrists into community optometry. I think this really is of a very, very important, this really is a very, very important topic. And I'm sure you are the best person to throw some light because you are an optometrist yourself working into public health. So without any delay, please, I am handing over the stage to you. You can continue. Thank you.
Uh, Thank you so much, Paula, for the introduction and also for the opportunity. I'm so glad to be here. Can you confirm if my um, screen is visible?
Yes, yes.
Sorry. Okay. So my screen is visible, right?
Yes, it is visible.
Yeah. Thanks, Paula. Once again, thank you for the opportunity. Since a lot of practitioners are there, and also I believe some students will be there. So I would like to more spend on the uh, interactive session, answering to your questions because that will open up more an opportunity to discuss and debate on it. My PPT is like very basic, just to give an outline what exactly happens in a broader public health scenario and how it is relevant to the optometry, and also what are the roles for the optometrist in public health, or else you can say how optometrist can play a role in public health, right? And we most commonly for the public health term, because we're into eye care, I rather say we commonly call community optometry. So I'll be talking about a very brief introduction about the public health and the community optometry and how it is connected to the high health and what are the current challenges in eye care. Because whenever we talk about any opportunity, first we need to understand what is the problem behind it, and also we want to know what is the magnitude of the problem. Then definitely there comes the opportunity. Okay, so we'll be briefly discussing about the current challenges also, and ultimately I'll be talking about the what is the scope for the optometrist in the public health sector, or what role they can play, and what kind of the career opportunities available in India or maybe on a broader globally. So I'll be discussing about it. So going first to about the introduction about public health. So when we talk about public health, it's about prevention of any diseases, right? So we want the main focus is on prevention of diseases by promoting it and also prolonging life among the population as a whole. So when we talk about the clinics, the focus is more on the, we call it as a patient, or we call it as a subject, or we call it as an individual. It is more focused on a person and an individual. But when we talk about a public health program, they are more an umbrella term. We focus more on the community on a larger. So that's what the public health means. And also in public health, we addresses the main health problem. Okay, by providing, creating the awareness, promoting about the diseases. Ultimately, the goal of the public health is to play a pivotal role in the preventive care. So it is something like, I would say, uh, before step to the clinic. So where in the clinic we see more about treating the patient, diagnosing the patient, treating the patient, and also managing the patient. So public health, it talks more about the prevention. It's something like, it's not like that public health do not want them to the hospital. It's like we play a card on the prevention side, which is like a more, I mean, a very broadly, I mean, definitely there are many theories and there are many debates on it, but ultimately one of the focus is on the preventive care. And also it prioritize the health of the community. uh, as I told you, and the practitioners, they focus more on the individual patients. So some of the core principles of the public health, they are universal coverage reforms, right? So they focus on reducing the inequalities are there in the availability of the healthcare, or maybe the accessibility of the healthcare. For example, in the eye care, the objective can be whether the vision centers, whether the eye hospitals, whether the eye clinics, they are available at a certain areas, or maybe in a certain locations where they are available to everybody and they are like accessible. So on broadly focusing on the universal coverage, right? Basically, which means that we don't want any difference or disparities on it. For example, I am staying in a particular location, I can access the hospital, the clinic. Same time, there is one more person on the other side. For ABCD reasons, he cannot access the eye hospital. So that's where the public health plays a pivotal role, right? And the second thing is service delivery reforms, which means that organizing health services around the people needs. So the service delivery is more focused on the what the community is expecting, or the what are the demands, or what is the need of the hour of the people. That's what the focus of the public health. And public policy reforms on a very broad scale, the public health is also focused on the policies and reformations. Basically, the objective is to integrate health into all sectors. Okay, and the leadership reforms, establishing and building collaboration. So public health is not a standalone when we talk about the how the public health the system works. It's more about establishing and building collaboration with various stakeholders. When we say various stakeholders, if we see in terms of eye care, the hospital, or maybe the patients, or the community members, they are the stakeholders. And also certain cases, maybe some, for example, for some community program, somebody is donating to do the outreach. So they can become collaborators, or maybe they can become the stakeholders. Okay. And connecting the dots with the public health and the optometry, we usually call community optometry, and I believe most of the optometrists we have studied in our third year regarding the community optometry. So it is a basic method for the practice of community eye care. So basically it's a blend of public health practice set up in the eye care. So that's what it is, a community optometry. And also it provides a model for the promotion, prevention, and curation. So as told you, in public health and in the community eye care, we focus more on the promotion side. When I say promotion, it's more about creating awareness, giving the knowledge about the eye diseases, and it can be through various ways. It can be through integrating the IEC materials, which means information and education communication materials, or maybe with other areas. Okay. And comprehensive primary eye care at the community level. And the community optometrist also means that in the community level, maybe if you see the pyramid of the eye care, starting from a maybe a tertiary center or maybe center of excellency to the bottom line in the village, in the ground, we want to connect the dots and provide a comprehensive eye care event to them. And while we say comprehensive primary eye care, it does not mean that the whoever patient is coming, we can do everything to them and check out. No, it's not that, but whatever the best possible uh, treatment, or maybe whatever the best possible things we can provide to the patient, that's what it means. And also one of the important role of the community optometry is also to link the, or maybe to build the link between the ground to the next level. Suppose for simple example can be somebody running a clinic, an optometric clinic in the rural area. He might have diagnosed him with refractive errors as well as glaucoma, for example. So for refractive errors, an optometrist can treat it and give the glasses, okay, and further manage it. While as coming to the glaucoma, he need to send it to the next level. So the one of the important purpose and one of the important role of a community optometrist is to loop this patient to the next level. I mean, it should not be that, okay, I tested him, I have given for something else, glaucoma, it's not my responsibility. Somebody else will take care. So it doesn't happens like that. So the very important role and the responsibility of a community optometrist is to close a loop. Yes, he cannot treat it, but definitely he can give a counseling to him. He can talk about the problem, what kind of a treatment he can receive at the next level, and further sending him for the further treatment. So the connecting the dots and closing the loop is very, very important in the public health or community optometry. So some of the aims of the community optometry, as I said, to sensitize about eye health, which means that to create awareness about the eye health. We know that most of the people, they're becoming visually impaired, and most of them, they're going blind because they do not know about the problem. So that is very important. And also to promote eye health at the community level. As I said, so as a community optometrist, public health, these things happen more in a community sector. I mean to say, this doesn't happens inside the hospitals, right? So usually we do have conferences and workshops, or maybe specialty workshop, which is for the internal stakeholders, maybe optometrists, ophthalmologists, or the eye care professionals, or anybody. But whereas here the focus is more onto the community level, which means that we are teaching to the general community about anything, a very basics about refractive error. They need to get treated, they need to get a pair of glasses, and it can be cured. So the sensitization or the promotion happens at the community level. And also to establish collaboration, integrate and build referral mechanism, I already mentioned about it. One of the important thing is to connect the dots and close the loop by referring them to the next level. It can be a secondary center or maybe tertiary center basis on the level which they are doing the screening programs. or the outreach programs, and also onto a broader to contribute to the reduction of the prevalence of blindness and visual impairment. Ultimately, we know that as a professionals, we are always aim to reduce the prevalence of blindness. So that's where we are all contributing to. Some examples are to just talk about what happens, or maybe what an community optometrist contributes. Some examples is the community outreach programs. Simply means doing vision screening programs for the adult communities or for anybody. School vision programs. Okay. Community health fairs. Community health fairs in the sense this is the latest concept where they will have a various health stakeholders, for example, eye care, dentistry, physiotherapy, other, all people will come in a single umbrella and they do a kind of a mass awareness and also do a screening. Okay, and they are interlinked. They will have a general physician along with other sectors so that they can do a comprehensive examination to them, and later whatever the problem they have they will send it to there for future reference. That by doing so, uh, what we are doing is we are integrating the eye care into that, and also helping. Suppose patient coming to general physician, he has diabetic retinopathy problems, right? He can diagnose that he has a diabetic retinopathy problem, but he may not treat it. So definitely he need to send it to ophthalmologist, or maybe at the initial level to the optometrist. Then later optometrist will diagnose, and whatever basis on that he will further refer to the ophthalmologist. And also collaborations with the non-profit organization. Lot of the non-profit organizations like We Are Vision Spring, or focus is more on to the community outreach program and to provide glasses to them at their doorstep, right? Big and while we are giving them the spectacles, the one of the objective is also to create awareness about the problem, and also giving them the glasses, later on following with them whether they are wearing it or not, and whether it is impacting in their life in terms of the productivity or maybe whatever work they are doing. In terms of the adults, we can say if somebody is not able to work or maybe not able to perform because he cannot see, after giving the spectacles definitely there will be some improvement. Similarly, in school children, if they are somebody sitting in the back side, he cannot see the blackboard, so maybe after giving the glasses to see whether there is any difference, if there is an improvement. So that's about. And also now the one of the latest technologies which we are doing is the mobile eye clinics. Lot of hospitals, lot of NGOs, they're coming up with the mobile eye clinics where they will have a basic eye setup, and they can go to the villages where they think that the eye care is not accessible to them. Maybe vision centers is not surrounding to their areas. So they directly go there and give the treatment to them. In some cases, they also integrated diabetic retinopathy and other things, diagnostics, so that at least they can diagnose them and give a tele-ophthalmology services if at all it is feasible. Okay. Maybe some cases, uh, maybe the opthal can come on over telephone and or through a video call and treat it. If still it is not happening, definitely the patient will be sent for further referral. So these are some examples. I'm not saying these are the only examples. These are some examples which I quoted, and also I assumed that you can correlate this, and also you can think about it, because we usually see all these things happening around us. So coming to the main problem now. Now, yes, well and good, we are talking about public health, we are talking about the community optometry. Okay, if somebody is interested in this topic, or maybe somebody interested in the subject or the sector, he want to move in there. But what is the magnitude of the problem? What is the size of the problem? So because basis on the size of the problem, there will be a opportunity, right? Without a magnitude, or maybe without the severity of the problem, there won't be a need of any person who will be dealing with it, right? So that is the reason we see the magnitude of the problem, and it's very simple, right? We all know, as per the WHO, the leading causes of visual impairment and blindness is uncorrected refractive errors and cataract. Okay. Globally also, if you see, uncorrected refractive errors is the leading cause of the visual impairment, and optometrists play a very, very important role in this area, right? So in my next slide, I will talk about what is the percentage of it. And the second is the cataract. Third is the diabetic retinopathy. Then later the other diseases, it can be ARMD, glaucoma, and some other diseases are there. But broadly, it is uncorrected refractive errors, cataract, and diabetic retinopathy. So coming to the problem, uncorrected refractive errors contributes to 42%, which is very, very big. So, I mean, imagine optometry, the optometrist is fitting here. Okay. And this is very much in control of an optometrist. If we can identify a patient who is having refractive errors, if we can kind of diagnose them, and if we give a simple pair of glasses, it can be treated, right? So, but this percentage is there maybe because of awareness, or maybe other things like they do not have a how should I say, accessibility to the vision centers or to the hospital. Second is the cataract. Here also optometrist plays a very important role, because optometrist can diagnose a cataract, so they can grade it and further send it to the next level, to the ophthalmologist for the surgeries. And remaining are the which contributes to 18%, where optometrist can play a role in terms of the referrals and also looping it to the next level. So when we talk about the magnitude, so it is 42% of uncorrected refractive error, which is very, very significant. And we can see that the optometrist can well fit into this in nutshell into the sector and give their contributions. So coming to the scenario in India, so the earlier slide we have seen more about the global, and in India, bit people around 50 years, cataract is the major problem, and refractive error stands to 13.4%, which is still a significant number. I'm coming to age between 0 to 49 years. Again, here refractive error is one of the major problem here. So there is a scope definitely where optometrist can play a role. Definitely, in people are working in clinics, they are providing the all kind of treatment they can do through opticals also. Various ways they are doing their best, but still there is a space, there is a scope where a public health or an optometrist can play a role in the community level. So coming to the broad difference between the clinical care and the public health. So coming to the objectives of the clinical care and the public health, we all know in the clinic, the objective is to treat and cure the patient. Whereas in the public health scenario, it's more about prevention of diseases. And in the clinic, in the hospital, the target is on the single patient, whereas in the public health scenario, it is on the broader population and the community. Coming to the diagnosis in the hospital, we do a physical examination, use various diagnostic equipments. Whereas in the public health scenarios, it can be broader screenings, okay, and health surveys. I said health surveys because sometimes when we collect the data, when we infer the data, we come to know lot of things, that why there is an existence of this problem. For example, I said refractive error is the one of the leading cause of the visual impairment, so maybe we can get the answers for that in the public health. Okay. And another example is the community diagnosis. And coming to the treatments, in hospital, the focus is more on to the by providing the glasses or the drugs or the surgery. Whereas in the public health, it's more about health education, immunization programs, prevention of diseases. Coming to the outcomes in the clinical and the preventive, in the clinics, it is limited to individual as we discussed. Whereas in the public health, it's more about on the quality of the life in the community at a broader. So some of the major roles where an community optometrist can play a role, those are by doing eye camps for refractive errors, surgical camps for diagnosing cataracts, research into eye diseases, policy development, implement policies for prevention purposes, designing, planning, and disseminations of fact-finding surveys, and also planning primary eye care programs for screening, health education, training, promoting community participation, program and project management. So these are some of the major roles. Coming to the career opportunities, those who are interested in community optometrists, maybe in public health, broader public health, they can go for higher education. Maybe they can pursue MPH after their bachelor's, or they can do masters in community eye health. And also, if they want, they can go for PhD. They can focus on individual or private practices in the rural communities. Okay. Collaborative or group practice. Collaborative or group practice means, I will give a simple example. If somebody is there in a rural area where they do not have any vision centers or eye hospitals surrounding 200 kilometers or maybe 150 kilometers, so an optometrist can set up a community center, do the screening program, do the screening, and also give them glasses. If they have any problem, they can tie up with a ophthalmologist or the nearest eye hospitals, and they can loop that patients to that hospital. So this will happen collaboratively, and I have not put here the if and but terms, but yes, this is a workable model, and lot of people are doing this in rural areas, and also where they do not have a presence of the bigger hospitals and the institutes. Opportunities in the government programs, like most of you know, there is a program called Rashtriya Bal Suraksha uh, Karikram, something RBSK. So they're recruiting optometrist. I think it is there in almost all the states of India, except for two, three states, as I know. Interdisciplinary care, you can work in broader healthcare organization focusing on the eye care, or else you can go to academics, research, or universities. You can work in corporates also. I can give some examples in my next slide. Developmental organization and international NGOs like Vision Spring is there, Sight Savers is there, Sight Life is there, Orbis is there. Many big organizations are there whose focus into the ground, but their roots into the global. And social enterprise, coming to the social enterprise, is again a new concept where the organizations are trying to give a solution to a problem with how should I put it, like giving solution in a less price. Suppose, for example, for refractive errors, we need to provide them glasses. If they go to market or maybe to the private clinic, that may cost them around, let's say, 500 to 1000 rupees, because there are a lot of factors involved. Whereas in social enterprise, they're trying to just reduce the burden of the cost, and but still providing them the solution. And another option is freelancing and consulting, which many people are doing. So some designations are working as a community optometrist, field optometrist, becoming a trainer, and working as a uh, capacity building trainer in learning and development, becoming a program manager, project manager, becoming a research and evaluation, monitoring and evaluation specialist, community outreach and education specialist we can become. So these are few things. I hope I have finished on time. So I wanted to spend more time on questions. I mean, if you have any questions, I'll be happy to answer.
All right. Thank you. Thank you so much for this insightful presentation. And bang on time, we have still around half an hour to take questions. And I personally have few questions. But before going to my questions, there are two on the chat. I would like to take them. So Monali has asked, is it right to prescribe a distance power glass in camp?
Okay. So, to answer it, yes, to a certain level, if at all, if you are able to close the loop. When I say close the loop, for example, we did a screening of a particular subject. He was having some basic power, let's say -1 in both eyes, and further he didn't require any uh, intervention. So definitely we can prescribe. But whereas For example, he was having a refractive errors plus he's also having cataract. So on that case, we do not prescribe distance glasses. The reason is the moment though we give counseling to them saying that this glasses is only for the distance, he need to wear it for the distance, but he may neglect the cataract assuming that they have given treatment for me. So most of the times it happens that the moment we give the glasses, they think that it is the ultimate solution for all the problems, right? So we give the glasses for the refractive errors management. So if they're having any clinical ailments, this is the universal formula that we do not give glasses. Rather, we refer them to the hospital. Once they are diagnosed at the hospital with XYZ problem, then later we give them the glasses. So yes, if they do not have any other clinical ailments, no, definitely if they have a clinical ailments.
Yeah, and I would like to add upon what Chandrasekhar was saying that being an optometrist, this is the beauty. When we reach out to the communities, we have the knowledge of understanding whether we need to prescribe them right away or we really need further evaluation or refer to higher center. It's not just we blindly follow a protocol, but we, after completion, we have the capacity to think and decide for a patient, which is the beauty. And optometrists have the intelligence and the right kind of education to take that decision, I guess. Okay, so we have another question which is regarding job opportunity. So Sneha is asking about which course to enroll after BSc, as she is interested in public health, and
Okay.
scope of optometrist in public health in a corporate. So maybe you can take both of the questions in
Yeah.
same time. Yeah.
So I will answer this question in two parts. The part one, after BSc, if you want to get into public health, so I divide this answer into two parts. Let's say if you still want to work in a hospital, but you want to be a community optometrist, then I would definitely say you don't need to pursue any course. You just need to align your interest with your employer and say that, see, I don't want to work in a hospital sector. Rather, I want to be involved in a community screenings. Thus, you can develop your expertise and become an expert as a community optometrist. You don't need any additional qualifications for it. Second answer is, let's say if you want to become a completely a public health professional where you want to categorize yourself as a public health professional, yes, then you can go for higher education. You can pursue MPH, or else you can pursue a master's in community health. I think it's only there in LV Prasad Institute at this stage, I believe. They've been delivering this course with the collaboration of UNSW, I believe. I don't know how it is running, but yes, that course is there. You can go for Masters in Public Health post the BSc. And for MPH, Masters of Public Health, the basic eligibility is any healthcare graduate, they take it. So you can join there. And coming to the opportunities in the corporates. So for example, best example is the Carl J's, right? They're corporate company, but they do lot of outreach camps. Maybe there are two ways. One is part of their CSR activities, or else sometimes it is research based because they want to test some models. So they do recruit optometrists and put them on the community level. So that's where you can work in corporate hospitals. So there are many organizations like Carl Jess is there, and many bigger companies are there which recruit optometrists to work as a community optometrist.
Okay. So now time for my questions, Chandrasekhar.
Okay.
Okay. So first we'll start. You joined as an optometrist in it was in University of Hyderabad, but what motivated you to pursue masters in, your public health? And yeah, so what kind of motivated you, and when did this motivation basically come? In which year of optometry, or if you can just give some brief, and then I'll ask the second part. Yeah.
Okay, so I maybe it's funny and also maybe I should not tell this, but I want to be honest. So when you dislike something, automatically you start liking something else. So till second year, I was confused in the optometry. I was not sure what I should do. And also I was not too much interested in working in the core hospital sector, because if you're an optometrist, definitely that is the primary job. Somehow I didn't wanted that. During third year, because I was in University of Hyderabad, the advantage we had is like we used to interact with various departments. So I come to know something about public health. Then I started studying from third year. And thankfully, during our third year, we had a community optometry course, which was then taught by the LV Prasad and faculty from the LV Prasad Institute. And they gave a very wonderful, impression about what community optometry, what public health does. So from third year, I would say the third year, second semester, I started, I kind of aligning my interest towards optometry, community optometry, because I didn't want it to be in clinics. So I made my mind that okay, I will go to the community optometry sector where I need not to be maybe completely in the hospital, but spending more time on various things like community screenings, research, education, lot of interdisciplinary things are involved. And by fourth year, we had a one course called public health management in our university. So that's what like when I made a mind that okay, this is my purpose. So I got my answer for my calling. Okay, I will. And one more thing, which I said that till second year, I was in confusion what an optometrist will do. And definitely whatever the job roles which were told, I'm not saying I disliked it, but which was not kind of my interest, right? But one thing like uh, I understood the problem and the magnitude, so I kept my purpose that I will be in the eye care only, whether I die, but I will do something for the eye care. So that's what I motivated, and I aligned my thoughts and my purpose with this. And by fourth year, I made a mind that I will be in public health, and later, obviously, I tried applying to the MPH courses in various university and again get back to the same university. So
Okay, so from your journey, what is one quick advice you would like to, give to the students as well as the faculties? Because I believe when we are into our first years or second years, faculties are the one who can, pick up the interest level, and they can be, a guiding star that okay, fine, if this person is not entirely into hardcore clinical, they might be interested into something like this, and then guide. So what is your advice as per your journey, or maybe because you said you picked up the interest, or as per your journey, what would have helped you a little better, and would have given you more support in terms of choosing this? So a quick tip to both the students of optometry as well as the faculty.
yeah, so the first thing is to the teachers. I would say they are like very pivotal in our life. Of course, in my case also, teachers played a very important role. I can take the names also. So they played a very important role. So the core purpose of the faculty should be like, for example, when once they start the course, no, so in the first year, in the first semester, they should more focus on the overall what will be the journey of an optometrist, and what will be the how should I say, the prospects or the scope of the optometry. That helps a lot. So now a lot of universities are already following. So any course you join in institutes in first year, in the first initial days, they do not teach any subject to you. They rather teach what happens in this particular course, like what are the career opportunities, what kind of subjects are there. Then students get thinking about it. Okay, these are the courses. My interest align with particular courses. So they can refine, and by usually in the first year they will have all common subjects, and when once they move to the second year, the things become easy what they want to pursue. So it's an important role the teacher should play, that giving them the right foundation about the course rather than the subject. So there is a difference. Talk about the course, what happens in the optometry, what is the outcome of the optometry, what are the future, what is the scope available in the market. If they talk about it, that clarifies a lot, because I interact with lot of students. Most of the students are in third year, fourth year. Still, they are puzzled. I mean, I don't want to blame the institutes or the teach. That's how the current situation is there. But definitely, we improvised a lot. So I think that orientation course in the beginning is very, very important. That helps a lot. And coming to the students, so once they joined, definitely first year going to be very confusing. It happens not only with the optometry, I would say it happens with any course. I interact, being a university student, I happen to speak with lot of departments. I mean, you will be surprised for them. For some, like it's fourth year, still they don't know what they're doing. So don't worry about what you are going to do, but whatever you are doing, do it with a mind and run after your purpose. Okay. And I would say, at least for optometrists, you should come to a conclusion or at least an idea by second or third year, because 3 years you will be studying and fourth year definitely there will be going to internship. So second and third year are very crucial to figure out your purpose and pursue it. So these are the two suggestions.
Okay, I hope whoever is a faculty or a student, attending this will get some perspective. We have a question from Jasmine. She's saying that India has a lot of burden of these kind of diseases and government is directly responsible. So how can an individual allied healthcare worker get alliance with such programs like you talked about RSBV?
Okay, so RBSK. So RBSK is like a government program. So for government, we know that they have their own formalities and structures for the recruitment. And coming to the RBSK, it's actually an integrated model where they have a dentist, physiotherapist, general physician, and the pediatrician. They all come together and run this program for actually children's. So I just given one example, right? There are many. Now, lot of ESI hospitals, lot of district hospitals, they're recruiting optometrist. And if you go to the bigger institutes like AIMS, I'm just referring, I may be wrong. I'm just taking example of AIMS or some bigger hospitals where they have an dedicated ophthalmology department. They have a position for community optometrist also, because not everybody work in clinics, right? A bigger institute will have a all kinds of uh, uh, avenues. For example, take the example of LV Prasad Institute, Shankar Netralaya, or maybe Arvind Eye Hospital. They are like a blend of everything. They are into core clinics, they are into education, they're into research, they're into the community care. So it's a collaborative and interdisciplinary. So definitely for the community, as I told, if you are interested, you can directly talk with your employer and get into the community eye care. You need not to have any academic qualifications in addition to the optometrist. Your expertise itself will do. Yes, if you go into a very broad thing like you want to become an independent practitioner, then maybe do some courses like, as I said, masters in community eye health, or maybe some short-term courses just to understand about the public. A lot of institute like IPH Bangalore, then IIPH, Indian Institute of Public Health, they give a lot of short-term courses. You can pursue that, and by that courses you can practice independently as a community optometrist, preferably in rural places. If you are anyhow into the broader metros and all, you can more call yourself as a clinical practitioner. But same, if you are into the rural sector, you can more call yourself as a community optometrist. The reason is you will have a less of resources and less of opportunities. You need to work independently, and definitely you need to align with, or maybe you need to link with the further hospital, or maybe an ophthalmologist, or maybe with some NGO, something like that.
Yeah, so coming to the private practice point of view, because as you know that OCI kind of, encourages optometrists to have their own independent practices, especially, when students come to big cities for the education, we kind of try and tell them that it is always better to, go back and serve your community. And there are people who are doing it more and more. Now, when it comes to independent practice, as you said, that of course, if you are in a semi-rural or semi-urban or a rural setup, then your resources would be confined. You might not have a huge resource. So, how can a private practitioner, because I'm sure the private practitioner will start from a one-to-one, like a one patient kind of a job, and that will be a day-to-day clinical job the independent practitioner would do. But how can an optometrist who is placed in such a critical area, where we call it a rural area or a semi-urban, where anyway services are less, how can they extend and provide services to the community?
Okay. So, Paula, as I said that if you want to practice in rural area, definitely you should have a loop to close. Okay. Because any screening programs uh, which happens in anywhere, the core foundation or the formula is that once they are screened, we need to close the loop. For example, if they have a refractive errors, we are treating them and giving the glasses, job done, right? If they have a cataract, we cannot leave them. So definitely we need to counsel them and send to the next level. Yes, when I say we need to send, does not mean that we take the ownership of it, but at least best possible way you collaborate with ophthalmologist in some nearest city. Okay, give him a referral card or something, and tell them these are the guidelines you will be taken, or maybe charged this much, or maybe you can put they can be treated under particular scheme and they will be treated free. So those things need to be told when they're doing it in rural areas. And also, as I said, uh, when we do it in rural area, I emphasize that it's going to be more challenging compared to cities. Reason, uh, without doing any screening programs, nobody will come directly to you as a practitioners, unlike in cities, right? In cities, the knowledge about the optometrist, at least now people are aware about optometrist in cities. But if you go to the village or the rural level, there is still, how should I say, a doubt, or maybe they do not know what optometrist does. They only know doctor, right? And definitely, if I'm going to my village, they know that I'm not a doctor. So there is a big challenge that they will not come to us. So that's why we need to go the other way around, collaborate with the eye hospitals, do a monthly screening programs, okay, create awareness. Then later they only come to your clinic for any refractive errors, or maybe you can practice even contact lens for any higher clinical ailments. Then they can send back again to the hospital. So it's a kind of a collaboration between the community and the optometrist and the hospitals. And at the community level, they can talk to the panchayat heads, or maybe they can even talk to PSCs. They do help, right? We are just helping them. We are not kind of occupying somebody's market. It's all about a very, how should I say, collaborative model. And also definitely during that process, we need to come up with a common agreements. Everywhere we do have agreements, like who will deliver what, how the scope of the work will be there. That has to be defined. So that's what I'm saying. So in working independently in rural going to be a challenging model. That's why I said to link it with the hospital, or maybe collaborate with ophthalmologist, then practice it. And also it will be exciting for you, right? You can't work alone, treating
Yeah.
them, giving them the glasses. So we always need some flavor on the work we do. And it really helps, right? If you need any help, you call up Ophthal, he help you. If he need any help, he will call you. So it's all about collaboration.
Right. Um, what is the biggest gap, maybe, between the optometry and the public health space, according to you? I mean, you have been in this space almost a decade now. So, what do you find is the, biggest gap? And we all talk about reaching the, now it was 2020, now it is 2030. and we are all talking about, making India free of avoidable blindness. But still, achieving this kind of a target, there must be some gaps. And how do you feel optometry can, fill this gap? This is your completely your experience. I'm sure there will be a lot of people who will have their own opinions, but as we have you as an expert today, what is your perspective on that?
This answer again, it's very practical question. And coming to the biggest gap in the industry, if we see, as we spoke about refractive errors, right? It is one of the major leading cause of the visual impairment. And we know that the simplest solution is providing a pair of glasses. But why they're not wearing the glasses? So the simple answer is the lack of awareness and also the lack of detection at the early stage, which is one of the, the major gap which I have seen practically. Now also, many times I do visit eye screening camps. I just go for monitoring, sometime for clinical auditing. I do interact with the patients. So usually we call subjects. So when we interact with them, maybe they're 40 years, 45 years. They got a very high power glasses. When we talk to them, uh, did you visited hospital before? Have you gone to hospital to get your eye tested? They simply say, no, no, I'm all right. I didn't had any problem. When we say that, no, no, you are having this much of problem, and maybe this is from many years. He said, yes, yes, I was having this problem for 10 years, but I could able to manage it. So lack of awareness is a very simplest thing, and that is a biggest gap. So that's where optometrist can play a very important role in awareness, okay, in health education. And second thing is also shortage of trained professionals also. If we go to the rural area, for example, in our case, we are giving glasses, and the first time wearer rate is sometime it's very surprising, 90 to 99%. So why the percentage is so high? Because they do not have an access to eye care, or maybe there are not enough trained eye care professionals available to them in their hand. Definitely, maybe a lot of people are educating, but most of them they end up in metro cities or the urbans or the bigger cities. But what about the rural area? So definitely that is a biggest gap. So rural area remains a significant problem in public health, that they do not have a proper accessibility, or maybe to put it in other way, the availability of the eye care professionals in the rural areas. So that's where again an optometrist can play an important role as a community optometrist or a rural optometry practitioners. And even lot of eye hospitals, they are doing a lot by setting up vision centers, doing lot of camps, but the gap still exists. So, and it's an opportunity for the optometrist. People who are coming from the rural areas, they can go back to their villages and have a beautiful life, right? Enjoying the nature and doing your practice there. And also, just to keep you updated, you can attend workshops, conference, meet your friends in Bangalore or whatever, go to the places. But you can have your roots back to your places, so that those gaps can be filled by you. Because ultimately, when we see a problem, somebody has to need to take a step, and that step has to taken by me and you. Nobody else will come there. Yeah.
Absolutely right. So, for the audience, I'm sure a lot of you have this question that, what to kind of pursue if we really want to jump into a public health education as well as job or sector. So what we will do is, we will connect with Chandrasekhar later, and we will have a consolidated kind of a list where maybe he can uh, 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 give us the information about few of the universities from where you can pursue, and short term courses, as well as the kind of job areas where, so we will make this as an activity and we will share with all the participants. You can send us an email at info@ocindia.org. Bhavya, you can put the OCI email ID. And I think it is time now, and we really need to close the session. But before closing the session, I would like to summarize this, that it is often a misunderstood question that whether optometrists as primary eye care clinicians really have a meaningful role in public health. And I'm sure after today's discussion, we can all agree that yes, their involvement in public health is not only relevant, it is really essential. Now, optometrists today are expanding the reach of eye care services. In public health roles, they can design and implement school eye health programs, plan community vision screening camps, advocate for inclusive policies such as low vision, elderly care, children vision, collaborate with governments and NGOs for universal eye health coverage. And about choosing public health as a career, as we have a great example like Chandrasekhar, who is an optometrist by qualification and then now later has moved into public health and doing a PhD. It is just not a deviation from the natural extension of the clinical work. While clinical optometry serves individual patients, I'm sure his presentation beautifully explained that. Public health optometry works at a population level, aiming to improve access, equity, and outcomes across entire communities. So, a final thought for all of you who joined, and I think this will echo with what Chandrasekhar reiterated, that as an optometrist in public health, it is not about abandoning the clinical work, it is about scaling the impact. So, an optometrist goes from helping one patient at a time to helping thousands at once through a system, through change, through prevention, through awareness. And we feel that this career is not just justified, it is really critical to achieve vision for everyone. I am sure the audience must have gained a lot of insight, and this session is recorded, and if you really want your students or young optometrists who are a little inclined towards community eye care, we can share it with you. You just have to write back to us. I'm sure Chandrasekhar, you're okay with this conversation to be shared with people.
Yes, yes. Okay.
Thank you so much for your time, and yeah, we'll see you in some of the conferences, I guess.
Thank you, everyone.
Yeah, thank you so much. Thank you
Thank you.
everybody for your
Thank
time.
you.
Bye. Bhavya.
Yes, ma'am.
Bhavya,
I was
I guess.
not able to unmute myself.
Yeah,
Yeah.
yeah, I actually did it in the starting only, so because
Ah,
some आवाज आता है तो. So I guess regarding the job opportunity, we can connect with Chandrasekhar and then we can share it as a document to all of them. That would be beneficial, I guess.
yeah, yeah, sure, we can do that.
And the educational opportunities.
Yeah, actually, that question was more common among most of them. I think those two will be very
I know that would have, yeah.
important.
But I think our aim today was to, kind of have this conversation of the gaps and how optometrists can, fill the gap. But job opportunities, I guess, yes, maybe we can have a session later on. But if people write, then we can kind of share that document to them. Yeah.
Yeah, yeah, sure, ma'am. Okay.
All right. Okay. Thank you. Thank you, everybody. Bye.
Thank you, everyone.